Duchenne muscular dystrophy is a genetic disorder. Look at this picture, shows that muscular problems. And for diagnosis, using electromyography, look at this. A detail going on. Introduction. Duchenne muscular dystrophy DMD is a severe type of muscular dystrophy characterized by rapid progression of muscle degeneration, primarily affecting boys. DMD causes progressive weakness and loss of muscle function due to lack of the protein dystrophin, crucial for maintaining muscle cell integrity. A definition. Duchenne muscular dystrophy is a genetic disorder resulting in muscle degeneration and weakness due to mutations in the DMD gene, which codes for dystrophin. This X-linked recessive disorder almost exclusively affects males with an onset typically before the age of 5. Types. 1. Duchenne muscular dystrophy, the most common severe type, primarily affecting skeletal and cardiac muscles. 2. Becker muscular dystrophy BMD, similar to DMD but less severe, as some functional dystrophin is produced. Causes. DMD is caused by mutations in the DMD gene located on the X chromosome, which leads to a lack of functional dystrophin protein. This mutation occurs spontaneously or is inherited from the mother, who may be a carrier. Risk factors. 1. Gender, primarily affects males. 2. Family history. A positive family history increases the risk. 3. Genetic mutation. Carriers of mutations in the DMD gene can pass the disease to offspring. Complications. DMD can lead to severe complications as muscle weakness progresses, affecting 1. Cardiac muscles, cardiac myopathy and arrhythmiasis. 2. Respiratory muscles, breathing difficulties often requires ventilatory support. 3. Mobility, progressive loss of walking ability leading to wheelchair dependence. 4. Skeletal deformities, scoliosis, and joint contractors. Pathophysiology. The DM mutation leads to the absence of dystrophin, a protein responsible for stabilizing muscle cells during contraction and relaxation. Without dystrophin, muscle cells become fragile, leading to cell damage and progressive muscle degeneration. Inflammation, fibrosis, and fatty infiltration replace normal muscle tissue, leading to functional impairments. Here is step by step look at the pathophysiology of Duchenne muscular dystrophy. One, genetic mutation in the DMD gene. 2, absence of functional dystrophin protein. 3, increased muscle fiber fragility. 4, calcium influx and cellular damage. 5, inflammatory response. 6, replacement with fibrous and fatty tissue. 7, progressive muscle weakness and loss of function. 8, cardiac and respiratory involvement. 9, complete loss of ambulation. 10, end stage complications. In the last stage, individuals with DMD experience severe respiratory and cardiac complications due to muscle deterioration. This cycle of muscle fiber damage, inflammation, fibrosis and loss of function underlies the pathophysiology of Duchenne muscular dystrophy, resulting in the progressive and severe muscle wasting disease. Signs and symptoms. 1, early symptoms, delayed motor milestones, difficulty in walking or running, frequent falls. 2, progressive symptoms, waddling gait, difficulty climbing stairs, enlarged calf muscles, Gover's signs, difficulty rising from floor. 3, late stages, loss of ambulation, scoliosis, respiratory difficulties and cardiac involvement. Diagnosis. 1, physical examinations assessing motor function and gait. 2, certain kindness CK test. Evaluate CK levels, indicate muscle damage. 3. Genetic testing, identifying mutations in the DMD gene. 4. Muscle biopsy shows absence of dystrophin in muscle tissue. 5. Electromyography EMG assess muscle activity. 6. Cardiac and respiratory test, echocardiogram, pulmonary function test. Nursing diagnosis. 1. Impaired physical mobility related to progressive muscle weakness. 2. Ineffective breathing patterns related to respiratory muscle weakness. 3. Risk for falls related to muscle weakness and instability. 4. Impaired cardiac output related to cardiomyopathy. 5. Risk for ineffective coping related to progressive and debilitating condition. In management, first medical management. 1. Corticosteroids, prolonged ambulation, slow progression of muscle weakness. 2. Cardiac medications, ACE inhibitors, beta blockers to manage cardiomyopathy. 3. Respiratory support, non-invasive ventilation, tracheostomy if needed. 4. Physical therapy, maintain flexibility and prevent contractures. 5. Orthopedic interventions, braces, corrective surgery for scoliosis. Nursing management. 1. Mobility support, assessive devices, exercises and education to reduce fall risk. 2. Respiratory care, monitor respiratory function, educate on breathing exercises and assist with respiratory devices. 3. Cardiac monitoring, regular checkups for cardiac function. 4. Nutrition support, balanced diet to maintain strength and avoid obesity. 5. Psychosocial support, counseling for patient and family support groups. Treatment. 1. Gene therapy, exploring gene replacement and editing techniques. 2. Exon skipping, targets specific gene mutations to produce dystrophin. 3. Stem cell therapy, investigational, aim to restore dystrophin production. 4. Physical therapy and occupational therapy, support functional abilities. 5. Surgical interventions to correct chondritis and scoliosis. Psychosocial medicine. 1. Mental health counseling, support for depression and anxiety. 2. Social services, assessing families with support resources and respite care. 3. Support groups connecting with others affected by DMD to reduce isolation. Prevention. 1. Genetic counseling for families with a history of DMD to assess carrier status. 2. Prenatal testing available for families at risk to detect DMD mutations during pregnancy. In conclusion, Duchenne muscular dystrophy is a challenging and life-limiting disorder with a significant impact on the quality of life. Advances in gene therapy, respiratory support, and psychosocial interventions have improved outcomes. Comprehensive management, including medical, nursing, and psychosocial care, is essential for improving life expectancy and quality of life for those affected by DMD. Have a nice day.